Hi everyone. In this video, we are going to see about the teenage pregnancy. I'm Ms. Ruth Kesia, working as a tutor in Tripoli College of Nursing. The objectives in this video: introduction about the teenage pregnancy, background of the teenage pregnancy, dilemma of the teenage pregnancy, issues, and how to manage the teenage pregnancy. These are the things we are going to learn in this video. First is introduction. WHO defines teenage pregnancy as pregnancy between 13 to 19 years old. It is a complex issue. It is a serious problem worldwide. It is a combination of both health and social problem because teenage pregnancy is considered a dilemma, and some will accept and some will not accept in the society. So it is also a social problem, and annually there are 14 to 15 million births worldwide. Teenage girls accounts more than 10% of the birth. So this is more, right? And more than 90% cases occur in developed countries given by WHO in 2009. US has the highest teenage pregnancy rate in the developed countries, and UK has the highest incidence in Europe, which is 24 births per thousand women. Okay, this is about the incidence and introduction of the teenage pregnancy. So next is the incidence. Okay, how it is prevalent in India. So only 2% of the teenage women in the highest wealth quintile have started having children in this age group, compared to 10% the lowest wealth quintile in India. Okay, so if you see in the picture, the in Tamil Nadu it has 6.3% and 5.0. Okay, and the prevalence of teenage childbearing is highest among these caste groups. This is about the incidents in India. So we are facing dilemma, right? So there are so many dilemmas faced by the teenage pregnant woman. Okay, whether to have the baby, whether to continue the pregnancy, how to get delivered, and even if it is delivered, how to care the baby, how to raise up the child, and how she is going to join if she is studying or if she is working, how she is going to continue everything. So comes as a dilemma for the patient as well as the caregivers. Okay. So in India, how the teenage pregnancy is seen, the teenage pregnancy is socially and culturally accepted in India. Okay. Okay, what are the risk factors of teenage pregnancy? How teenage pregnancy occurs? So first thing is the social cultural early marriage. In some castes or in some group of families, they socially or culturally they have a practice of early marriage. Okay. And that is less than 19 years of age. 13 to 19 is considered as a teenage pregnancy. So even before 19 years, they will marry. They will marry they will do the marriage for the teenage girls. And being a child of teenage mother, so if the mother has got a baby during her teenage age between 13 to 19 years, and that the child is also going to end up in the same problem, likely to end up in the same problem. And next is learning difficulty and mental health problems. These girls might end up with teenage pregnancy. And next is experience of physical or domestic abuse in childhood, domestic abuse during the childhood age, and a low self-esteem. So the girls with these problems might end up in teenage pregnancy. And yeah, other risk factors are not using contraceptive methods in the first sexual experience and limited access to contraception. These situations might end up or lead to teenage pregnancy. So, what does the law state about teenage pregnancy? According to sections 375 of Indian Penal Code, considers sex with a female under age of 18 is a minor, because a girl is considered as a minor, and that sexual intercourse is considered as a rape. The doctor aborting a minor pregnancy has until now been required to inform such a matter to the police. Okay. While the age of a consenting female has been raised to 18, the law has not been revised in case of a married minor girl. So this is the situation of the law regarding to teenage pregnancy in India. So what is the dilemma faced by our side? It means the caregiver, or it means the educators. Okay. So the sex educations nowadays not much encouraged in the schools. You know, They teach the good touch and the bad touch, but still the details of the sex educations are not being taught to the students. And limited or no access for education and information on reproductive sexual health care. Even if you take the teachers also, that some might feel shame in teaching the students about this, or even the students even they feel discomfort in hearing this, embarrassed to hear about, to teach about this topic. Okay. And limited access to the education and information. And policies often restrict adolescents access to information and services. Example, contraception. So this contraception, like morning pills or condoms, are not easy to get by a minor students, minor age students, like less than 19 years of age. So the policies are restricted for them to reach this contraception. So what are the issues faced by the teenage pregnancy? So there are, it is divided into 5 categories: antenatal, intrapartum, postpartum, social and offspring issues. Let's see them one by one. Antenatal issues. What are the lack of antenatal care? So the problems faced by the teenage pregnant woman, or a lack of antenatal care, unsure of the date, illegal termination, malnutrition, sexually transmitted diseases, social issues like smoking, alcohol and drugs, pregnancy-induced hypertension or eclampsia, anemia, low birth weight and premature labor. So these all because they don't have adequate knowledge about how to care for the pregnancy, how to take care of the baby and how to take care of herself. Because of all these problems, they face this malnutrition, or the sexually transmitted disease, low birth weight, premature labor, anemia, and other associated conditions. And they also unsure of the date. Okay. So these are the antenatal issues. And the next is the intrapartum issues. So during, even if the girl gets pregnancy and successfully finishes the 9 months, then during labor she is going to face pain as a big problem, because she is not been subjected to that kind of pain. Okay, so pain will be a new thing for her, and the cooperation and the uh, psychological support for her will be more. Okay, so she needs more psychological support, and because she has more fear, right? And mode of delivery will be due to will be mostly by cesarean section, because of immature pelvis. The pelvis is not grown adequately, and the head cannot pass through this pelvis. Okay, outlet will be small and the inlet will be small. So in that case, the head cannot pass through that, which is considered as cephalopelvic disproportion. So in that case, they have to go for the cesarean section. And the third issue is the issues with the spinal and the epidural due to developing vertebra. So usually the spinal anesthesia is given between L3 and L4. Okay, so this vertebra is now still developing. In that case, the space between two vertebrae will be difficult to identify for the anesthesiologist. So that will also be a problem during the intrapartum period. And the postpartum issues, the mother, of course, the girl is going to have postnatal blues or depression, because even the grown up adult woman will face this blues and depression because of the change in roles. Okay, she is now she was a daughter and she was a wife, and then she is again changing the role of your mother. Okay, so she needs time to adapt, even for the grown up woman. But if you take the teenage girl, this is going to be definitely a problem for her. And next is the social support. if the social support is not good, the money and the financial support, if it is not good, then that will also be a issue in the postpartum period. And resumption of education. See, the girl is still studying or still maybe doing work, so resuming her education and resuming her role in the society will also be an issue. And next is the contraception. Okay, we just want to prevent the next pregnancy to occur, so the contraception should be followed. And other issue is baby dumping. So you might have heard dumping the baby in the dustbin and everything. Okay, so that also is a major problem faced during this postpartum period. And the social issue, what are the problems faced socially by these girls? These are, they are like unmarried, unemployment, easily abused, neglected, ill-treated, suicidal thoughts, poverty, engage in high-risk activities, poor school performance, poor reading ability, and drop off school. So these are the social issues faced by the teenage girls. And next is offspring issues. What does the child, okay, who's born to a teenage girl is going to face? What are the problems faced by this child? It means the child may have neonatal and the post-neonatal mortality, poor development, child abuse and neglect, intellectual, language and social and emotional delay. So everything will be delay for the milestones. Okay, milestone achievement will be delay for this babies. And poor academic performance and poor reading ability, smoking and consuming alcohol, behavioral problems and engaging in crimes. So all these problems will occur for this offsprings of the teenage pregnant girls. And next is management. So how we are going to manage this teenage pregnancy? This is also classified under 5 headings: antenatal, intrapartum, postpartum, social, and offspring. First is antenatal management. So what we should do to manage this teenage pregnancy? First is the services should be easily accessible for the patients, for the mothers, and in people friendly environment, and ensure confidentiality, partner and family involvement should be there, and strong referral links with the relevant agencies like social workers should be given for the mother. And dating the pregnancy, okay, accurately date the LMP is very important, last menstrual period. And routine antenatal care should be given for the mother. Okay, they may miss the visit now and then, so that should be emphasized for her, and make sure that she visits the hospital at the given date. And provide nutritional advice and supplements. Advise on the antenatal care, monitor weight gain, blood pressure and fetal growth, and encourage smoking, alcohol and drug cessation. So if at all the mother is having this problem of smoking, alcohol and drugs, you should tell her to stop at once, and encourage to join in antenatal classes and preparation of labor. So all these health educations must be given for the mothers who are in teenage. And next is intrapartum management. So what are the things we can do for the teenage pregnancy during labor period? That is a need for assessment for CPD by doing a university scan or clinical examination or per-vaginal examination. We can find out whether there is CPD, whether the pelvis is adequate for the head to pass through. Should be done in the third trimester. Sorry. And next is the cesarean section for evidence of obstructed labor. So if at all we found there is any CPD, or when the labor occurs, and if there is any obstructed labor during the first stage or the second stage, and the cesarean section, the theatre should be ready we should anticipate the cesarean section, and everything should be ready. Okay, and need early anesthetic referral for choice of anesthesia, because pain will be a big problem for these mothers because they are of young age and they cannot bear much pain. Okay, so anesthetic referral is very very important. Their choice of anesthesia, and we should tell them what are the anesthesia types of anesthesia available, and how it's going to give a pain relief for them, and they can choose by their own during the antenatal period itself. Next is the postpartum management. What you should advise is advice regarding the perineal hygiene, the breast hygiene. You should advise them on the contraceptives, on the immunization and the newborn care, and how to feed the newborn, how to do the burping technique for the newborn, how to take care of the herself, the personal hygiene and everything. Okay, even the social support also you can refer the woman where she can get a financial support. Okay, and assist in the child growth, and if at all the mother goes in for postnatal depression, you can assess it and detect it early and give a referral and counseling to her accordingly. Okay. Next is contraception. So after the postnatal period, after the preparing period, of course, she is going to, she has to follow the contraception methods. First is the that is the oral pills. Okay, oral contraceptive pills. Which is a failure rate is 50% because due to non-compliance, because every day morning they had to take this tablet. Okay, only then it will work. Once sometimes if they forget, that comes as non-compliance and it will not work. So the failure rate is 50% in that. And next is the implant, contraception, and the failure is only 0.1 over 3 years, and the weight gain is less than 10%, and irregular bleeding can be there. In the third choice of contraception is IUCD. The failure rate is 0.8. In view of risk of chlamydia infection, advisable to take endocervical swab and to give antibiotics before fitting IUCD. So before fitting IUCD for the teenage girls, you have to give an endocervical swab and to make sure there is no infection or chlamydia infection, and you can insert the IUCD for the mother. The fourth choice, the Depo-Provera, which is an injectable contraceptive. So greater than 2 years, risk of reduced bone mineral density if usage greater than 2 years. And condom, which is not safe. So usually we don't advise the condom for these type of girls. And next is social management. Okay, that is about the postnatal management, postpartum management. And next is the social management. What all you can do in the social management is reference to a social worker for financial assistance, ensure family support because the baby is at great risk of inadequate growth and infection, and child care and adoption service advice can be given, and return to education and training and employment. They advise regarding how they can return to education, how they can return to training, and how to return for the employment is very important. Next is advice on financial and housing support. Take the necessary action according to the Child Act 2001 if the adolescent suspected to be physically or emotionally abused, neglected, or sexually abused. So if the adolescent is say physically or emotionally abused or neglected, if you suspect like that, then you have to do the necessary action according to the Child Act 2001. And next is refer the child to the protector, and the police officer or the doctor should take temporary custody if unable to contact them. So all these things should be done for a girl if we suspect any physical or emotional abuse. And next is schooling. Of course, if the mother is doing schooling and she has to resume her school. And teenagers should always be assisted in returning to school either during pregnancy or after delivery. Okay, she should give adequate assistance for the mother to resume her schooling. Next is offspring management. Offspring issues involvement of child protector, and so involve the child protector. Okay, so next is if any evidence of child abuse or neglect, JKM has the power to take the baby up and place him in a safer place. So if the child is not being protected, or if the child is neglected, or if the child is abused, you have the power to take up the baby and place them in a safer place, and child can be given for the adoption. So next we are going to see about the prevention and recommendation. What are the strategies we can, what are the things we can do in prevention is forming the national strategies regarding uh, teenage pregnancy. Okay, it means forming the guidelines and the laws and the policies to be followed for a teenage pregnancy in the national wide. And next is the school-based health, life and sex and relationship education. So in the school itself, okay, so 13 to 19 years is considered as teenage. So 13 years, if the students are studying 13 years, then and that time itself we have to give the education regarding how to take care of their health, how to take care of their life, how to take care of their sex and relationship, and everything should be given as a health education for the students. Campaigns and media should be arranged, and availability of the contraception should be made ensure, and access to abortion services should be made easy, and coordination national, state and district wide. Okay, so whatever the policies are formed in the nationwide should be followed in the state as well as the district levels. The recommendations will be life skill based health education, support services for adolescents, involvement of family members, increased access to contraceptives, information services like sex education, skilled antenatal and birth care, special sensitivity in dealing with adolescent girls. So these are the recommendations which can be given for the teenage pregnancy. So they should be given life skills based health education, support services should be made available for the adolescent girls, and family members should be involved, and access to contraceptives should be made more, and information services 24 hours, okay, information services on the sex education should be available for this teenagers, and skilled antenatal and birth care should be available, and special sensitivity in dealing with adolescent girls, okay, should be given for them. So all this should be followed for this to prevent a teenage pregnancy, as well as to ensure they get adequate education regarding this teenage pregnancy for all the students who are there in the schools. So till now we have seen about the introduction of the teenage pregnancy, the incidence, what is the incidence worldwide and as well as in India, and what are the issues faced by the teenage girls, antepartum issues, the intrapartum, the postpartum issues, the offspring issues and the social issues, and same way the 5 headings: antepartum, postpartum, intrapartum, offspring and social social categories are followed, or we also seen that 5 headings in the management also. Okay, how to manage this teenage mothers. And next we'll see about the we have seen about this prevention and recommendations. I hope you gained some knowledge about this video. Okay, see you in the next video. Thank you all.